And welcome to the program. Good to have you with us here on Coastal Daybreak here on the Talk Station FM 107 and AM 1240. Time now for Sugar Talk with Dr. K. Jean Lucas, and she is here in the studio with us. Good morning, Doctor.
Good morning.
What are we talking about today?
We're talking about diagnosing diabetes.
I think a lot of people have a lot of misconceptions about how that's diagnosed, but you actually have, and actually learn through this program, you have some pretty clear guidelines and pretty clear markers.
Yeah, there's no borderline diabetes, just like there's no borderline pregnancy. So diabetes is pretty much defined as a specific number.
Mm-hmm.
And this is taking the whole population in mind and dividing it by statistical means. But diabetes is diagnosed by an A1C, which is that average sugar test of 6.5 or more. And that sort of gives you an idea of what's going on in your body over the past 3 months. And that's when sugar sticks to your red blood cells, and red blood cells live for a long time. And you're seeing the percentage that have sugar stuck to them. So that means that the sugar has been elevated in your blood during that 3-month period to give you that high A1C.
So how does this look back 3 months? How do you actually tell?
Well, because the red blood cells live for 120 days, which is 4 months.
Mm-hmm.
So what you're doing is, if your sugar has been elevated during that time, this extra sugar will stick to the red blood cells, and you can measure the percentage of hemoglobin that has sugar stuck to it.
Mm-hmm.
And normal is 5% or less, and diabetes is 6.5%. So that's a lot higher. Normal range goes up to 5.6, but really perfect A1Cs is 5 or less. So the more sugar that's stuck to your red blood cells, the more sugar stuck to your body. So they designated that as a way of diagnosing diabetes. That was fairly recent. It used to be just a fasting blood sugar or a blood sugar after eating. So now it's a fasting blood sugar of 126 or more on 2 occasions, or any blood sugar over 200.
Mm-hmm. Okay.
So when people say they don't know if they have diabetes or not, I mean, you look back at the numbers and you go, yes, you do, or no, you don't. Now, there's some extenuating circumstances. Sometimes people's blood sugar goes up when they're on like prednisone or some kind of cortisone or something like that. But that's still not normal. I mean, that is not, you have to watch out for those people, because if you've had high blood sugar when you're pregnant or when you've gotten medications that raise your blood sugar, then you're more apt to get diabetes later anyway.
So, if somebody is taking those steroids and taking prednisone, et cetera, do they have to, or diabetic especially taking them, or do they have to take some extra insulin or extra precautions?
Yes, especially people with diabetes that take prednisone, and people give out prednisone a lot for sinus infections or asthma or joint pain, back pain, gout, a lot of things people are getting prednisone for, and you really have to make sure the doctor knows you have diabetes, because some of it's through urgent care or ER, but they'll still say, well, your sugar might go up, and you need to check your sugar more often, and if you need extra medication, you'll probably have to call your doctor to get extra medication. If you're already on insulin, you just take more insulin. If you're on pills, you may end up needing insulin depending on how many days the prednisone lasts.
Okay. So, and steroid medicines are one that when you take them until completion, right? I mean,
right. I mean, if you're on them, if there's a reason to be on them, then you should finish them off. And usually it's a prednisone pack, which starts with like 6 pills and 5 pills, and for each day you go down on the dose. So the worst day would be the first or second day when you're on the highest dose, but it can still stay high after that, because high blood sugar tends to poison your pancreas, and your pancreas sort of backs off and it's not able to make as much insulin. So when you have a high sugar like that, it's real important to get it down so that it doesn't stay high after you finish off the prednisone.
Okay, back to the diagnosis though. You say that the levels are what, 6.5?
6.5 A1C, or any blood sugar over 200, or fasting blood sugar of 126. So
you say perfect is 5 and 5, 6 or so. What if you're in that between stage?
Well, there's a pre-diabetes. Yeah, now there's a pre-diabetes designation, and that's between 5.7 and 6.4. Although that's a little bit iffy. You can call people pre-diabetes. That's sort of like if they're 6 at least to call them, but it doesn't really matter, because what you're trying to do is do the same thing whether you had diabetes or not, is get rid of the belly fat and exercise and eat right. So it doesn't really matter the designation as much, but what you're trying to do is not to get diabetes at all, because that means half of your ability to make insulin is gone forever by the time you get diabetes. That's why when people say, do I really need medicine for diabetes? I'm like, well, half your pancreas is, the ability to make insulin's gone. And so it's a genetic defect that causes that, and you probably need to be on medicine. And the American Diabetes Association recommends, metformin for pre-diabetes, and that's why you try to be on something before you get diabetes so you can reverse it and get the A1C back to normal.
How is it that some people who seem to be very large that don't have diabetes?
It's just a genetic problem. I mean, it's not the only reason people are overweight.
Even type 2?
Yeah.
Okay.
So there's 10% of type 2s that are normal weight. They still have belly fat.
Right.
But they don't look like they do. I mean,
yeah.
And they may complain about their little belly, but everybody's like,
Yeah.
Come on.
Yeah.
They're not really, excited about it. But 10%
like the person who complained about having an A- in school,
I know, so we don't really think about that. But a lot of Orientals that get diabetes don't really get huge, but they do have belly fat. They have more belly fat, so it's sort of interesting.
Hey, welcome back here on Coastal Daybreak on the talk station FM 107 and AM 1240, 726 in the morning, here with Dr. K. Gene Lucas from Diabetes and Endocrinology Consultants, and they bring you Sugar Talk every Monday morning. So again, when we talk about diagnosing diabetes, then you have to talk about what do you do if you catch it in the early stages. Is it better? I mean, you're better off catching it early?
Yes, we've caught a lot of people early. If you catch it in the pre-diabetes stage, you really want to be aggressive. So you want to make sure that A1C goes down and not up. And there's plenty of medications now that help you with that. The metformin is the first one, but there's other ones in case you have problems with up and down blood sugars during the day. There's other medications that fix that so you don't wear out your pancreas. And that's sort of our focus, is when we get people with pre-diabetes, we want to keep them that way or make them better.
When people go to see health fairs, sometimes they catch it, maybe on a sugar test. Just
a random blood sugar, especially if you went to Bojangles that morning.
That's right.
They check it after that. That's a good test.
Yeah. But acting on it soon is a big deal.
Yeah, you don't want to just ignore it. A lot of people just say, well, that's just that's probably a lab error or something. But you want to confirm it. And if you know it's in your family, then, you suspect that's really what's going on. And it's one thing that you'd rather not ignore, that you'd rather go ahead and be aggressive and get with it. Get on your diet and start exercising and be on medication if you need to be, and just work on that.
How is it that weight loss surgery then reduces that risk so significantly?
Well, for one thing, you can't eat much. And then... However, and then immediately your blood sugar goes down. So a lot of times people on oral, especially people just on oral medications for diabetes, goes down really quick. That's why when we see somebody with a high blood sugar, like new diagnosis, all you have to do is say, quit drinking the sugar drinks and don't eat this and don't eat that, and the sugar will come down on its own. Just like weight loss surgery, you're not eating much. And then your sugar comes down pretty quickly, and you can't really take your medicines a lot of times because you can't swallow big pills. So a lot of times you're just stuck with just the diet alone, and that the diet alone is helpful. People come in to me and they're on 5 different classes of diabetes drugs, and you're like, let's try diet now. And it's amazing. You just tell them what to eat let's do it for 1 week. And then it's amazing how quickly the sugar comes down when you just stay away from foods that cause the sugar to go up.
Are triglycerides related to blood sugar?
Yes, it's another genetic problem, but some people, their triglycerides go up when they eat carbohydrates. Of course, alcohol makes your triglycerides go up. Starches and sugars make your triglycerides go up. And so some people have that same problem. Their triglycerides will be high and their sugar will be high. And of course the triglycerides are carried along with cholesterol. So when your triglycerides are very high, then the cholesterol goes up really high. So it's not a cholesterol problem, it's a blood sugar problem. So getting the blood sugar down, the weight down, gets the triglycerides down and the cholesterol down.
All right, there you go. And you have some more research studies going on now?
Yeah, we have a type 1 and type 2 studies still. And we have a triglyceride study as well.
And you're not too far away from another school. You're going to do one this fall.
October 15th at the aquarium.
That'll be a new spot again for you, right? So
Yeah, we've never
you're
done
doing
diabetes school there.
You're doing the tour. It's like concludes the tour this year.
Yeah, we're
right?
checking them out, checking out these places.
That's great. I think it's made access better for more people. So again, keep in mind that you want to find out more. You go to beachdoctor.com and get all the information that you need about diabetes and endocrinology consultants. Learn about the schools and the studies, etc., and find out more information about how you can be healthier too. Thank you for being with us here, and we'll see you next week.